after how many rounds of antibiotics should you consider looking for a different answer? Okay, is it 5? Is it 6? Is it 3? How about after how many asthma attacks should you consider your child maybe needs to look at something else different than the medication we're given? See, like just taking the medication to cover up a symptom, it would be like taking a fire detector and taking the batteries out and expecting the fire to go away. Okay? It's sure, you're going to get some sleep, but you're going to sleep right through the fire. You're going to sleep right through the cause of the problem. And so we're going to ask a different question today. We're going to ask the question, why does your child sick? Why are they chronically affecting their body in a different way? And so that's what I'm going to talk to you about today, because this topic is near and dear to me because I was that kid growing up. I was the kid taking these little brown pills in the summertime when seemingly nothing was going on. Why do I have to take them? They look like little brown M&Ms without the M on the signal as well. I was the kid that, had the snotty nose and blowing out all the time. I was the kid that was running around in gym class, like coughing up phlegm a lot. I was that kid that missed 10 days of school in first grade. I still remember that. And, having problems a lot all the time in sickness. But I was that kid that was fortunate enough to see a chiropractor at such a young age and ask a different question because my life changed after that. Because then I realized that when I was in second grade, when I got adjusted by a chiropractor, that I felt amazingly different. Something happened to my body that woke it up, and I'm like, what happened? So when I started learning more about this, I started looking about, hey, let's ask a different question. What does our body need to stay healthy rather than wait for it to be sick? So you see, the nervous system is married to the immune system. They are like hand in hand, just like this. And an increase in nervous system, where it's increase in function, where like sympathetic tone, where we're worried about being fight or flight all the time, well, it definitely decreases the immune system's function because we're not worried about fighting off bugs. We're thinking that a tiger's chasing us all this time. Our nerves have even been proven to communicate with white blood cells in the nervous system. Think about this. Let's give an example for an ear infections, all right? Definitely a lot of upper neck issues with that, but what's happening is the fluid in the ears is backing up, and that fluid is like bacteria candy, okay? They love that stuff. It's nice and warm, room temp, just like awesome, like for growing bacteria, but it starts to get ear infections and inflamed all the time. And what's not happening is, one, the immune system is not kicking in because there's problems with the upper neck and it's not allowing the immune system to properly assess and treat the infection. And then two, it's like there's drainage, like there's tubes down your neck. And in fact, there's one tube that comes over here from this neck called the thoracic duct, and it bypasses your stomach so the stomach doesn't get all queasy and sick, and it goes out through the intestines. And usually kids with like ear infections, after a day or two of clearing it, will have like loose stools or diarrhea because they're trying to flush the system out. And that's the way it's supposed to happen. But when it's backing up, you're going to get the ear infections. You're going to get the head colds. You're going to get, and if it comes up far enough and starts coming down through the throat, then you get the bronchitis and those types of things as well, because it has to do with the muscles are not allowing the plumbing to be corrected, and the immune system is not allowed to function because there's nerve interference. So why? Why is my child getting sick? Let's start asking, just because the symptoms are turned off doesn't mean your child's healthy. Just because the symptoms are turned off doesn't mean that they're going to flourish. It doesn't mean that their body's functioning to their full capacity. When we look at the nervous system and we start to see how the body can respond so much better with a better functioning immune system, that's what we're going to look at, okay? And not to mention, we start to see some side effects when there's chronic antibiotic use. Hey, I had pneumonia one time. I had to take antibiotics. Great, okay? But I didn't have pneumonia every day of the week during the winter. And I didn't have to take them just to keep the pneumonia at the bay. And I'm saying, why don't we start looking at a different one? Because I've seen kids like that where they have to take antibiotics or the sickness comes back. And it's the antibiotics that's taking care of the sickness. It's not their bodies that's taking care of the sickness. So what can we do to build your child's body up rather than letting it stay down here and just turning off the smoke detector or the fire detector? What can we do to extinguish the problem and resolve the problem rather than just covering it up? Hey, I want you to think about this. I really want you to think about, hey, what is health and what we can do to help keep your child flourishing, because I don't want your child's last year problems to become your child's this year problems during what we call the cold and flu season, which is more or less like added stress season. Hey, I'm Dr. Randy Wirtz, pediatric chiropractor. I am here to help you and your family really thrive and take off. So please let me know how I can help you, and please give me a call. Let's see if chiropractic is right for you and your child. Until then, have a great day. God bless. Bye-bye.